Hey, welcome back, class. So you've made it to our last set of lectures where we're talking about infectious diseases. We're covering chapters 21 through 26 in this. So you'll have 6 different lecture videos to watch for this section. And in these, what I really want you to focus on is if I give you a disease, you can give me the name of the organism that causes it. Or if I give you a name of an organism, you can tell me a disease that it causes. Or you could tell me what type of organism it is, and then you can give me a few of those key signs and symptoms and important details that are listed here in the slides. Okay, let's start. Let's start with our skin infections. So first we have smallpox. This child here is a child that is dealing with smallpox. This is caused by the variola virus. This is a virus that is inhaled. It enters a respiratory route. And from there, it travels through the internal organs to the bloodstream and then to the skin, where it will create these pustulous lesions. So all of these projections on his skin are filled with pus. Smallpox was the first vaccine created and was also the first eradicated human disease. There was a global campaign to vaccinate all people, and the virus only lives in people. There weren't other hosts to worry about. So all people got vaccinated. And then in 1979, the last natural case was a child living in Bangladesh. And after that, everyone had been vaccinated and there was no one to get the disease. Although there are still samples of this virus in the CDC in Atlanta, and also Russia has a sample of these. We do keep enough vaccines and medicine in case there is a bioterrorist attack, although people are not routinely vaccinated for this anymore, except for some, specialized healthcare and military personnel. Next, we have papillomavirus, which causes warts. It can cause warts on the skin. It also can cause genital warts. And this is where the virus actually triggers the skin to start multiplying. So these proliferations are actually made of skin cells. It's not filled with pus or liquid or anything. It is skin cells growing. Then chickenpox and shingles. These are two very different diseases that present in very different ways in very different populations, but they are both caused by the same virus, by varicella. There is now a varicella vaccine for children, a chickenpox vaccine, and a shingles vaccine for adults. So there is no reason for people to be suffering with either of these diseases now. But typically as a child, the child would be exposed to the varicella virus. It'll enter their respiratory route, they'll inhale it, and then it'll infect their skin cells for 2 weeks, and they have this itchy rash. But then the virus doesn't go away. It goes latent. That means it is going to stay in the body in an inactive state. They won't have signs and symptoms. They won't be contagious. The virus will travel actually up the peripheral nerve to the dorsal root ganglion, and the virus will live in a nerve cell of the dorsal root ganglion. And your body is not about to kill your central nervous system cells. So it will just stay there until maybe in their 60s, 70s, it decides to come back out. And when it comes back out, travels back to the skin, it creates a different pattern of rash. You can see how they look different. But also, rather than being itchy, it's more of a painful, horribly painful rash. And this is typically seen in older adults instead of in children here. And then the virus can go back up to the dorsal root ganglion, go latent again, and then come out again. There can be recurrent infections of shingles. Anyone who has been infected with chickenpox can develop shingles, although there is a vaccine that will limit its ability to cause an infection. Then herpes. So herpes simplex-1 and herpes simplex-2 are two different subtypes of the same virus. Herpes simplex-1 is typically seen in the oral area, so it causes infections like this that are typically called cold sores and fever blisters. This is also a virus that can lay latent in the trigeminal nerve. So once you've had an outbreak of this virus, it is going to be in your body for the rest of your life. And you can have outbreaks of cold sores, anytime you're stressed out about something. Herpes simplex-2 is typically going to cause genital herpes, going to be passed through sexual contact. Although if there is contact between genital areas and oral areas, Type 1 can transfer from an oral area to a genital area, and type 2 can transfer from genital herpes to cause an outbreak in their mouth area. Then measles, which is what we have in this middle picture, sometimes called rubella, is caused by the morbillivirus. This is also inhaled. It has droplet transmission and will lead to a rash of raised spots. It was almost eradicated. There is a vaccine that is very good for measles, but there was some vaccine hesitancy that led to a resurgence. The goal was to have measles eradicated by 2020. We have not hit that mark, but it is still, an effort is still being put into vaccinating children for measles. This is a common childhood disease that does not need to occur anymore. Rubella is sometimes called German measles. It causes a more mild version of an outbreak. However, it is not caused by the same virus. So don't let that name trip you up. It is an entirely different virus. It is caused by the rubella virus, and it's its entirely own infection. Let's talk about some gross little parasites here. So first on top, these are mites burrowing into a skin. These mites are Sarcoptes scabii, that's your scientific name. So this is often called a scabies infection. As they are burrowing into the skin, they're trying to burrow in so they have a safe place to lay their eggs. It's intensely itchy. Not very comfortable at all. It can be transmitted by intimate contact, which does not just mean sexual contact. That means like physical, direct physical contact. 7-year itch. I don't know if I said that. Sometimes it's called the 7-year itch because of how itchy it is. Then pediculosis, which is the fancy word for lice. These are parasites that will get onto a person and then take blood from the host. Depending on where it is located, it has different names. So pediculosis humanus capitis, so pediculosis humanus, human lice. Capitis, so cap, like you wear a cap on your head. These are lice on the head. And even though it is common for kids to be sent home from school because they have lice and it can be spread and it's itchy and uncomfortable, it doesn't actually cause disease. There's no actual harm that can be left with a child who has lice. It's not an indication of their health. It's not an indication of their cleanliness. It's just they happen to get the bug on their head. Pediculosis humanus corposis. So corposis sounds like corpse. So a corpse is a body. These are body lice. However, body lice can spread disease. They are associated with endemic typhus, which we'll come back and talk about in a little bit. And then pediculosis humanus pubis is pubic lice, or sometimes referred to as crabs. Then acne. So I want to be clear here, not all acne is caused by a bacteria. There are different things that can cause acne, but some bacteria are caused by acne. Propionibacterium acnes is the name, that's a traditional name of this bacteria. Although the name of this has actually been updated to Cutibacterium acnes. So you may see either name, depending on the resource you're looking at. But this bacteria can grow in follicles and block the follicles, lead to inflammation. Eventually, the sebum, the oil, is going to accumulate and rupture the follicle. Acne is the most common skin disease that there is. You can look around and see that it's very common. And then impetigo. So I want you to be comfortable pronouncing that correctly. Impetigo. This can be caused by Staph aureus or Streptococcus pyogenes. These two bacteria, very common on skin, things that we're touching, and they're going to cause a lot of different types of skin infections. We're going to see their names pop up a lot in this chapter. So Staphylococcus aureus and Streptococcus pyogenes can cause impetigo, which are these like school sores is what they're sometimes called. They're common in kids. They're just these little isolated pustules that will be crusted over. Then scalded skin and toxic shock. These are also caused by Staphylococcus and Streptococcus. In scalded skin, the Staphylococcus will release a toxin called toxin B, which exfoliates the skin. That's what's in this picture. It does look a lot like burned. Scalded means burned, so it does look a lot like scalded skin. And then toxic shock syndrome. You may have heard of this infection before. Sometimes it's associated with tampons being worn too long. So a box of tampons will typically come with a warning about how long you should wear them. There's both a staphylococcal toxic shock and a streptococcal toxic shock, but either one of them will release a toxic shock toxin 1 or TSST1, which is released into the bloodstream. And because it goes into the bloodstream, it can travel throughout the body. So you see more systemic side effects. So you'll see fever, vomiting, shock, and even organ failure. It can end up being fatal if it's not treated. Then hot tub rash or folliculitis is an infection of the hair follicle. It is most commonly caused by Pseudomonas aeruginosa, one you're comfortable with from lab, or it can also be caused by Staphylococcus aureus. These tend to be opportunistic pathogens that are more likely to affect immunocompromised patients, but they can get into a wound and cause this infection. Just by way of interesting little facts, it can also grow on soap films. Then necrotizing fasciitis, which is also known as flesh-eating bacteria. This can be caused by a lot of bacteria here. Streptococcus pyogenes is the most common, group A strep specifically, but also Clostridium perfringens, Staphylococcus aureus, Bacteroides fragilis, and Aeromonas hydrophylla. So this bacteria can enter into an abrasion, and then it doesn't actually eat the tissue. It starts creating an endotoxin, and that endotoxin leads to destruction of the soft tissue. And the only way to get rid of it is debridement. So that is to remove the infected tissue. Here you can see a lot of his skin has been cut away. I had a student one year who, the day that we talked about this in class, she went home and found out that her dad had gotten an infection with group A strep that was causing necrotizing fasciitis, and he ended up losing his entire arm in an effort to get rid of that infection. So this is pretty serious. I mean, the picture is pretty bad because it is pretty bad. It can be type 1, which means polymicrobial. That means more than one of these microbes can cause it. It can also be type 2, which is monomicrobial, which could be caused by any one of these, most commonly group A strep though. Then some fungal infections. So mycosis is the generic term for a fungal infection. That myco, that prefix that we see when we're talking about anything fungal, and osis when we're talking about an infection. Then dermatomycosis, that derma tells you we're talking about skin. So this is a skin infection by a fungus. That fungus is mostly going to grow in places that are moist. Fungal cells like a lot of moisture. So it'll cause infections of things like armpits, on their feet, in genital areas. So it'll cause infections like ringworm, also known as tinea capitis, jock itch, tinea cruris, athlete's foot, tinea pedis, and nails, tinea inguinum. So this is ringworm. It does cause this ring shape, but it is not a worm. It is a fungal infection. These can be caused by several different genuses, trichophyton, microsporum, and epidermophyton. Then if that fungal infection gets a little bit deeper, it becomes subcutaneous, below just the surface of the skin, it's going to be more serious. These are commonly caused by fungi that live in the soil, something like rose gardener's disease or sporotrichosis, which is caused by Sporothrix shankii. This can cause small ulcerations in the hand where lesions will start forming. Because this is a soil fungus, it is common in people who are working in the soil a lot, maybe cutting up their hands or getting dry chapped hands while they're working. So gardeners and landscapers are the most common people who will have this. Then candidiasis, which is caused by Candida albicans. This is a part of the normal microbiota of the oral cavity and the vaginal tract. Although it's usually suppressed because there are lactic acid bacteria producing acid that keep it too acidic for the fungus to grow too much. Thrush is oral candidiasis, so it is a growth. These white spots are a growth of the yeast in the mouth. We see this a lot in babies who may fall asleep with a bottle or fall asleep while they're nursing, and that milk just sits in their mouth, and the yeast just go crazy and eat that. And then a yeast infection, also known as vaginal candidiasis, commonly seen when a woman is on an extended amount of antibiotics that kill off those lactic acid bacteria. Without the lactic acid bacteria, the vaginal tract isn't so acidic, the pH will increase and make a more attractive place for the yeast to grow. Then this is it for this slide. So some fun little eye infections here. When a staphylococcal bacteria infects an eyelash, or the follicle of the eyelash, that is called a stye. Conjunctivitis is when the conjunctiva are inflamed. This is called pink eye because, as you can see, it turns your eyes pink. It is most commonly caused by Haemophilus influenzae. It can also be caused by Pseudomonas bacteria. That's typically associated with contact lens use. If contacts are not being worn correctly or cleaned correctly, that bacteria can start to accumulate there. I think at the start of this semester, I shared with you a story about Pseudomonas infection of contact lens solutions, which was leading to conjunctivitis. And then inclusion conjunctivitis or trachoma, which is a chlamydial infection. As a newborn is being born, if the mother has a chlamydial outbreak, that chlamydia bacteria can transfer from the mother's vaginal tract to the baby's eyes, and also can be spread through swimming pool water, supposedly. This is actually a big deal because trachoma is the leading cause of blindness worldwide. Okay, so I will see you back in our next video where we talk about diseases of the nervous system. For now, if you have any questions about our skin and eye diseases, please let me know, and I will see you later. Bye.